Life is all about the gray area undefined. Life is filled with parallels. You can have your cake and eat it too. You can choose to live your life out loud, or you can choose the in-between or the middle of the road. Inside the gray area, that's where life happens. I'm Leanne O'Brien, Chief Marketing Officer for McGregor. Welcome to Inside the Gray Area, sponsored by McGregor. Thank you for joining us. I'm here today with Dr. Cynthia Balina, the Medical Director for McGregor PACE, and joining her is Keith Cavey. He is a psychiatric nurse practitioner at McGregor PACE as well, bringing integrated behavioral health and a whole suite of services to McGregor PACE that we have identified is a great opportunity for growth and a way to enhance the program that we already have at hand. Keith, tell us a little bit about how you came to join the PACE team and Dr. Balina bringing this program with you.
Absolutely. First off, thanks for having me. I was hired on in May, so about 3 months ago. I'm still getting my feet wet in PACE. I previously worked at University Hospital for about 5 years, and looking at PACE, it's really a kind of a revolutionary model, nothing that I've experienced before. From a worker's perspective, I'm sort of unhooked from productivity, and our outcomes are based on the patient caregiver satisfaction and overall ability to keep them out of the hospital and to keep them safe and at home. And so for the first time in working for healthcare, I'm no longer motivated by how many patients I can see in as short a period as possible, or how complicated their psychiatric diagnoses are, but rather the focus has shifted back to, frankly, where it should be, which is keeping people healthy and in their homes as much as possible. So it's been a fantastic opportunity to be part of PACE.
I think people misinterpret that word behavioral health. We experienced a lot of life changes during COVID.
Absolutely.
For sure,
Yeah.
including the isolation that many older adults experienced, as well as all generations of people, quite frankly. But it is an overall health and well-being. Why add this service to McGregor PACE?
That's a good question. I mean, the reality is patients are living longer. They are having more diagnoses, and a recent task force from the PACE organization did an evaluation on overall health and diagnostic information for participants, and they found that 70% of all PACE participants had a mental health condition. Additionally, without treating the mind in tandem with the body, you're never going to get the good outcomes you're looking for. Western medicine generally has been divided, with mind being separate from body. That split took place in the Middle Ages in Europe, and we're trying to bring it back to a more holistic approach where we are treating both the physical as well as the mental issues that participants are facing.
And can you speak more to what those behaviors were that you've identified?
Absolutely. Well, you have pretty common ones: depression and anxiety. Recent study came out, 51% of all Americans of all ages have dealt with some sort of psychiatric issue related to depression and anxiety over the past year.
Which is why every time you go to the doctor, they ask you how you've been feeling.
Absolutely.
Right? If you've had any of those.
We are getting better at detecting it, but still a long way to go. So those common ones, depression and anxiety, but World Health Organization has classified those as chronic and progressive diseases, the same as heart failure or COPD.
Sure.
But we also deal with schizophrenia, we deal with dementia-related behaviors, and I also have a subspecialty in addictions, and so we deal with a wide variety of substance use issues, all again in line with the PACE model of keeping people safe and at their home for as long as possible.
And then let's explain the integrated part of what that all really means.
Right, so this is right in line with the PACE's IDT, or interdisciplinary team model where you have, like Dr. Balina had mentioned previously, social work, transportation, dietary, physical therapy, occupational therapy, and we had, PACE had a robust suite of primary care services, but they were missing the behavioral health component. And so often psychiatry was treated as an outside specialty, same as cardiology or neurology. They would send them to an outside psychiatrist. And if you know anything about the woes with personnel shortages in mental health, it can take months to see a psychiatrist, very little follow-up. So they might get a note detailing the visit, but no collaboration. So I was brought on board to, in real time, consult with primary care and develop integrated behavioral health treatments that incorporate the psychiatric component in real time with the medical component. So oftentimes throughout the day, I'll get calls from a primary care who's identified a mental health issue. I'll come and work at bedside with the participant, with the primary care. We'll come up with a plan together that involves the family, the participant, primary care, as well as psychiatric care. If the case is particularly complex, I might take them on for one-on-one services. But the ultimate goal is, rather than have me be a standalone specialist, to rather work side by side with the primary care colleagues to get the overall best outcome possible for the participant.
Sure. So Dr. Balina, you were instrumental in bringing Keith on board. Obviously, you identified an opportunity here. Where do you see this going in the next decade?
As Keith mentioned, there is a huge need. People are suffering from these problems. They're just not being identified and treated holistically. So in order to reach our goal of being able to take care of somebody real time and keep them at home, we have to be able to bring all the parts of the services to the patients. In primary care, we are traditionally trained, and the emphasis is on, neck down sort of medicine. Mm-hmm. But we have to take care of the whole person. There's no way I can control your diabetes if your depression is so uncontrolled that you can't eat a diabetic diet. It has to go together. And primary care can do a whole lot of it. They really can, as long as there's a little bit of backup and a way to consult when problems get very difficult. It's a huge step forward in a holistic approach to a patient, not only identified by McGregor, but identified by the National PACE Association. This sort of integrated behavioral health programs are happening all over the country, and other PACE programs as well, and we are happy to join them.
Excellent. One thing that we haven't talked about is when somebody enrolls in PACE, when they become a participant, how is that paid for? How does insurance address the needs and the services you're providing?
Sure. So the model of PACE and the way that mission aligns with money is that part of the PACE umbrella becomes the person's insurance plan. We receive money from both Medicaid, if that person is eligible, and Medicare on a risk adjustment model. And we use that capitated model. We use that money to take care of absolutely everything. We buy your medicines, we pay for your hospital bill, we pay for the PACE center and the staff, but we also then have room to pay for your over-the-counter medicines, your incontinence supplies, transportation, everything you need. So depending on your eligibility for those two systems, mm-hmm. right, that is how it's financed. If you are not eligible, for example, for Medicaid, and you have resources, you are also welcome to be in our program, and there's an option to pay for it directly. Which seems like a lot of money. I don't know the exact number, but if you look at that number compared to a month in a long-term care facility, it's less than half. Mm-hmm. It's less than half, and the person doesn't have to live in the nursing home, and they get all of these services, including the behavioral health services, right in the home. It's doable for everyone, and again, like all other parts of PACE, we create a plan specifically for that person and their financial situation.
So there's essentially really no out-of-pocket expense if you've qualified for the program.
Yeah, it depends. For most Medicaid patients, there's no out-of-pocket expense.
Right.
It depends upon, if you do not qualify for Medicaid, there's probably a small fee associated, yes.
There's a little bit of a cost share,
Yeah.
yeah. And I think the other fantastic thing about this program is PACE will follow you wherever you go. So when that individual is no longer able to remain in their home, PACE will follow you to one of our residential services here on campus.
Absolutely. So the only place that we defer to others is in the hospital. When you're having a stroke, I really want you to be taken care of by the very best stroke expert in the city. I'm really good at primary care. I'm not the best stroke expert in the city.
Sure.
But once you leave the hospital, we're coordinating with the hospital to make sure they know your medical problems, they know your baseline, and they know your situation. But once you're discharged from the hospital, if you go to rehab, we're there. If you go home, we're there. If you need an alternate level of care, and now it's time for a group home or an assisted living, we're there as well. We're with you through the whole continuum. If you, at the end of your life, for end-of-life care, hospice care, those services are also available through the McGregor umbrella.
So it's a one-stop shop, basically, right?
That's the intent.
That is the intent, yeah. So you and both of you and your teams certainly bring that expertise to the community, to our families, and to those who participate in the program. What else can we tell our viewers?
Well, I would say if you know a loved one who is 55 or older, who's on Medicaid, and they are struggling with what they're going to do in their future, I mean, really PACE is a fantastic option. There is also room for the dual Medicaid, Medicare as well. It's the whole purpose of PACE started originally from kind of a Eastern medicine concept. It came from San Francisco, on lock, the Cantonese word, I believe, for peace and harmony. I'm not fluent, but
Okay.
The whole purpose was an alternative to living in an institutionalized environment. The thought of people aging and dying with dignity in the comfort of their own home. We certainly work in partnership with assisted living and independent living, and sometimes it works out that they just need an additional level of care that being at home can't provide. But I mean, it's really, in my mind, the way medicine should have been done from the beginning, where we are half the insurers as well as half the care providers, and the goal is on people living their lives as healthily as possible. The goal is not making $1 million. The goal is keeping people healthy and focusing on that, and that's really it's refreshing. It's the first job I've ever been involved where in healthcare where that's the focus, and it's less a business and it's more on creating good health outcomes, which is really refreshing.
Well, and it gives great support to the family who does have a loved one living at home with them. We see more today, again, I think, of that intergenerational family unit.
That's actually part of the rights and responsibilities in PACE, is that the family and the participant, the reason why we call them the participant is because in the Bill of Rights, they are directly involved in their care. It's not some faceless committee making the decisions behind closed doors. They, at any interdisciplinary meeting, the family or the participant can be involved if they choose. In fact, we encourage them to be included in their healthcare treatment, because really that's where the focus should be, on what they want.
And we've witnessed, PACE, the innovations that you and your teams come up with, the forward thinking of a program like this, and what it really can do to support those in the community.
It's been great.
Well, thank you. Thank you for
Thank you so
coming
much for
today.
having me. Appreciate it.
We enjoyed learning a little bit more about PACE, and
My
I'm
pleasure.
sure there'll be more to tell us about in the future.
You bet.
I'm
Thank
always
you.
happy to be here. Thank you.
Okay, thanks. Thank you for joining Inside the Gray Area. We're here to answer all your questions and share some interesting insights. I'm Leanne O'Brien. We look forward to seeing you next time, and be sure to follow us on social media and our YouTube channel.